Hi, this is Dr. Farley. In this blog, I want to go over with you the philosophy of healthcare. I think it's important to touch base on these things periodically. And what I see happening in society is people are moving further and further away from the truth, um, meaning that we don't understand what health even is. We've bought into the propaganda and we are trying to I'm not even sure what we're trying to do anymore, but we've lost sight. I had a conversation with my sister about my brother-in-law, um, and we were talking about being overweight and what does it mean, and having all of these different symptoms and what does it mean, and if there's an issue with COVID that your risk goes up and what does it mean. And so my sister follows certain principles. I think she gets the basic philosophy that what we're trying to do is remove interferences and allow our systems to work at a high level. And that must mean addressing stressors, physical stressors and injuries, chemical imbalances, and then lastly, mental emotional stressors, current and cumulative. Okay, so that's what creates imbalances inside the body. That's what chiropractors talk about, creating subluxations, and over a time frame lowers the person's ability to adapt, puts them in a state of dis-ease, and over time your body develops disease. So that process is absolutely true. I've been in practice now for 27 years. Had my first philosophy class, I think it was 1991. And to this point in time, and looking and taking care of thousands and thousands of patients and running thousands and thousands, tens of thousands of blood work and testing, and it's absolutely true. So when my brother-in-law goes to his general practitioner, and the general practitioner says, "Hey, throw a little bit of vitamin D in and take some zinc," but doesn't address his weight, that I'm going to say is 50 pounds overweight, we're not providing health care. We're providing disease crisis management. And the other gentleman that just went down on Monday Night Football, and they had the medical professionals get out there and take care of him and save his life, that's what the medical profession does at their best. They are much, much better than I am in that situation. But that's not health care. Let's be clear. That's crisis disease intervention. If you're in a crisis disease situation, either from some type of traumatic injury or because you put yourself there by not taking care of yourself and not understanding the basic premise, well, then you may need some of that crisis disease intervention. But you must keep in mind that that is not healthcare. And to go to those practitioners and ask questions about healthcare when they don't provide healthcare is a very dangerous thing. My blog last week was on colonoscopies and the real value of this, but we're all being told to do this stuff. And pretty soon, I realized that society has no concept whatsoever. What is the truth of health? Health is proper function, and proper function will be impacted negatively, and your ability to adapt will go down based on physical factors, chemical imbalances, and mental emotional stressors, current and cumulative. And then gradually we start to not adapt. We create these things that chiropractors call subluxations, and the whole system is moving in the wrong direction. And then with time, 10, 20, 30, 40 years, you finally get symptoms. The symptoms are not the cause of anything. The symptoms are the end. It is not the beginning. By the time you get symptoms, you should know your system is barely hanging on. It's like you're driving a car with the metal sticking out of all your tires, and you're at the end. So then normally what we do, though, is we start getting on the merry-go-round of let's pop a pill, let's pop a pill, let's pop a pill. And to go back with another blog that I made, the number one cause of dysautonomia from the number one dysautonomia specialist in the world are side effects from drugs. So because drugs are not required for health, if we're using them to manage a symptom, we must recognize, one, you might have a direct side effect. But even if you don't have a direct side effect, They're lowering your health, guaranteed, every capsule, every pill, every time, because it's not part of normal health and normal physiology. And over a time frame, it raises your allostatic stress load. It's like having a blister, and you keep sanding the blister. You keep irritating the blister over and over again. And then gradually over a time frame, that lowers your health a lot, because we've never identified the original reason for having the symptoms. We're now throwing medications on as a Band-Aid to possibly manage some of the symptoms. The underlying mechanisms have never been figured out. And now gradually you are on a roller coaster down towards death, down towards decline, down towards continued breakdown. You cannot get to health with that model. You can't. Now again, if you're the football player that went down, you got to manage the crisis. Once you're out of the crisis, then you got to go back and figure out, how did I get myself into the crisis? And it looks like there's going to be multi-factors for that, gentlemen, and we'll chat about that at another time. So the philosophy of the person that you go to, you must be aware of what their thought process is, because their thought process will be how they recommend things to you or not. If they're not clear in their philosophy, then gradually they fall into the symptom management type process. They look at the causes of genetics, which we know for sure 95% of diseases are not genetic. I mean, it's just not genetic. It's 95% caused by epigenetics. So epigenetics is what I'm a specialist in, and trying to understand what are the factors not letting this system work properly, and then how do we identify them, measure them, understand where we are as far as the baseline, and then set up a plan of action to restore function to the highest level that we can. And then also respecting your life and respecting your health. Recognizing this also, you are going to have to pay for your health at some point in time. You can find a practitioner and pay someone along the way to keep the system as optimal as you can, or you can wait until your crisis situation and someone that has to wipe your nose and have you go in and out of the shower. That's much more expensive, by the way. I have personal experience with this, of spending over $400,000 in a very short time frame to try to manage someone that put themselves in a crisis situation when realistically they could have spent money along the way. So there are no guarantees, but I can guarantee you this. If you find a good practitioner that has a solid mind and philosophy, you should pay that practitioner forever on some level to take care of you and your family. And don't buy into the idea of, oh, insurance. Insurance is for crisis disease intervention. I hope it changes. It's probably not, because that is the model. That model is, we give you a diagnosis, here's the drug, here's the surgery, keep you in the system over and over again. That is not healthcare. Not healthcare. It's crisis disease intervention. So if you have any questions, as always, please let me know. And again, philosophy matters. The practitioner that you see, you should look at, number one, is this. If they have a good philosophy, they're healthy. Do they look healthy? Are they taking care of themselves? What does their office look like? Do they present health to you? Are they showing you a healthy mindset? And if they're not, go somewhere else. Because when you go to the dentist and they walk in and the dentist has no teeth, why would you stay there? Find true practitioners that have a sound philosophy. And I will tell you this also, in my opinion, the most sound healthcare providers that exist today are chiropractors, because I've seen on a regular basis that if you find a good one, and a good one that understands the philosophy and has honed his skill. I don't mean someone that was trained and went to school 20, 30, 40 years ago and is doing the exact same thing and hasn't updated anything. I don't mean those practitioners. I mean true healthcare providers. They do exist, and in my opinion, if you find a highly sophisticated chiropractor, a brain-based chiropractor, a person that understands food and nutrition, they are probably the best person to have on your healthcare team. So thank you. If you have any questions, as always, please let me know. God bless you and God bless your family. Thanks.